Today, in our very hospital, we have a little baby girl with whooping cough. She's received no vaccine.
Any stimulus will prompt a paroxysm or episode of coughing till you're blue in the face, and many times stop breathing.
My little daughter, Elizabeth, was one of the children to die from influenza December 1st of 2003. On December 22nd, she was going to receive her vaccination for influenza.
Polio is a really scary story. Polio paralyzed. This current generation of parents have never seen polio. There's no polio in the United States. Why should I have my child immunized? We are a plane ride away from polio. The only child in my life I ever had to do a tracheostomy on was a child with measles. Scariest event in my life. Children would get measles encephalitis and never wake up.
The little boy arrived by helicopter, and his father said, "I didn't think he was so sick." In fact, he had a form of meningitis that is now entirely prevented by a vaccine. And I think about that dad periodically and know how much he wished he could have his kid back, and that a Haemophilus influenza vaccine would have saved that kid's life.
It only takes 20 minutes to get to the doctors, to get a shot and leave, and it can save your child's life.
I don't want to ever have to see a father like that who stands and watches his baby die in front of his eyes and realize that that's a death that's entirely preventable.
Many of these diseases are still around. It isn't like they've gone away, but if we stop immunizing, they will come back. You can bet your life on it.
We're one of the most highly educated states in the country. But the more striking thing is, how can we be 50th in immunizing our children, 50th out of 50 states, and be so if we're so darn smart, why are we letting that happen?
The Colorado Children's Immunization Coalition was created in response to the fact that immunization rates across the country and in Colorado were not nearly as high as we thought. We could do a much better job, and this organization has been working since that time to make sure children are fully immunized in Colorado against 13 preventable diseases.
The problem with having people not immunize their children is they become a potential reservoir for infectious disease. They can pass on the diseases to babies who haven't had a chance to be fully immunized. We have, as do most states, have a law that requires you to be fully immunized as you enter school. Two reasons primarily. One, you protect yourself from others, and two, you protect others from you.
First of all, immunizations are very safe. They don't cause the disease, they prevent the disease.
Accidents and injuries are much more likely to cause harm than the harm of a vaccine.
There is no earthly reason for anybody to refuse immunizations. The fear that people have, they're based on no reasonable data. They're based on myth.
Immunization registries are very valuable for public and private providers who give shots to our children.
A registry is used to help doctors and nurses know when child immunizations are due, so we can basically remind the parents to bring them in.
Immunization registry is secure, it's reliable, it helps us give vaccines quickly. I think it's easy to use.
A parent can go to any facility, any doctor's office, and be assured that his child's immunization records are there. Now that's important when you realize that the average child in the state will go to at least 2 different medical facilities a year, and if you're uninsured or you're in Medicaid, that could be 4 or 5 a year. Immunization registries, besides being a data bank, can be a notification system, so-called reminder recall, where you can remind parents that their child's immunizations are due.
From my perspective, as a director of a local public health department, I would love to see the immunization registry spread throughout the state. We in Colorado need to raise our immunization rates, and this is the vehicle that will allow us to do that.
Collaborations are important to CCIC because immunizations are given in different locations in Colorado, some in the public sector and some in the private sector, to make sure that we're reaching all of the children.
The Aurora Shots for Tots Clinic is a partnership between the Colorado Children's Immunization Coalition and their Aurora Project, Tri-County Health Department, and the Aurora Fire Department.
In all communities, there are pockets of under-immunized children. We provide them some resources and support and let them figure out how to operationalize it in their own community, what would work where they live and work to improve childhood immunizations.
This clinic is important for this area is that a lot of parents don't have insurance or have lost their jobs, don't have health care coverage.
The individuals that gave these 2 shots were very nice and gentle and caring, so it was a great time. There was no hassles, no long wait, easy, smooth, and most likely anybody that came to get the shots here would probably agree.
The motivation is to protect the kids against disease. And that's a job that we all have to have. CCIC focuses on it, Tri-County focuses on it, and now they have chosen to bring us into it. And we, as an EMS provider for this community, focus on things that will improve our community. And this will help the children. This will keep them in school. This will protect them against diseases and hopefully make this a better place to live.
I believe that immunization shots being combined with the fire department is a very wonderful thing, and I think it works out great for the community.
The CCIC does a wonderful job of building on infrastructure that already exists and making it blossom. CCIC's funding allowed our public health nurses to go into the community, to do outreach, to visit the providers' offices, and share information on immunizations to boost those immunization rates that are so critical in preventing diseases.
There is a responsibility that we all have as members of a community to assure that children are well immunized.
We have to focus on parents, and we have to focus on businesses, and we have to get to all aspects of our economy if we're really going to make a difference.
Having a service club type situation or group, you have a springboard to access business people, health professionals, teachers who are there because they care about the community. And it's important to care about the community, obviously, because it affects all of us. Look at the immunization, it affects our children, our prized possessions. But the one thing you have to have a lot of, and that is enthusiasm and determination. And I think we have to convey that message to the public so that businesses can give money to the organization.
CCIC is the only private nonprofit organization in Colorado working on childhood immunizations. Our approach and our status of working in communities at the public-private level and as a nonprofit organization is a unique focus that we have and a unique value, and we want to communicate that to citizens across the state and ask for their support and encouragement in the work that we're doing.
And it takes all levels of spread. It takes dollars, it takes people, it takes ideas, it takes surveys and research. You don't have to be a scientist, you don't have to be a doctor to work with this, because you can help in so many ways.
Parents, you are responsible for having your children vaccinated. Please do so, and please don't let another child pass away the way our sweet baby Elizabeth passed away.
Please keep our community safe by keeping your child updated on their immunizations.
We want to invite you to join us and protect children throughout Colorado from vaccine-preventable diseases. Together, we can make a difference for the health and safety of our children.
Yes, you guys are doing a good job, and thank you very much for the shots.